So outside of OptiLift, you mentioned that you're doing navigation. What are some technologies that you're excited about incorporating, or something that you see coming down in the near future that you think will really help patients?
Sure. Navigation is a great asset to any surgeon's practice. I think intraoperative imaging too, like intraoperative CT imaging, is very helpful to me personally. Just making sure I'm a perfectionist, so making sure everything is perfect before I close. But those have all had their advances over the years. But I think even in the past few years, robotics coming into the spine space is really fascinating, and trying to understand how we can make that better and safer is also going to be pretty. I think is going to be in the next 5 to 10 years in the spine world. It's going to be pretty common for most surgeons to be familiar with the robot. The worry I have with some of these technologies, though, is in training and how that affects training, because you can't have a surgeon that's dependent on navigation, because you've got to have a bailout strategy. So I think in training programs, just the traditional approaches is going to be very important to try to maintain those basics too.
Mm-hmm.
So
Yeah, it's fun. I was talking to one of the spine surgeons here locally a couple of weeks ago, and actually about OptiLift, and OptiLift is indirect decompression, and he's like, man, everybody's doing indirect decompression. I'm afraid a lot of surgeons are gonna lose the ability to do direct decompression. So to your point, that's interesting.
Yeah.
All right, so looking at medical device reps, in your experience, what separates maybe the good reps from the average or not so good reps?
I think, surgeons have a choice of what they, well, for the most part. Some facilities make surgeons use certain implants, but to be a successful medical device rep, you really have to, not only get along with the surgeon, but try not to have implants that are going to make them successful. But just from a basic standpoint, you have to be prepared. So when I first came out, I just, basically tried everything because I wanted to know it was good in my hands. I experienced a variety of different sets and a variety of different reps. And, obviously there's personal interactions and people that you naturally gravitate to, which is sometimes outside of a control, but try not to be too pushy, but also really knowing where your products succeed and how to articulate that. And especially in spine, you have a surgeon that does TLIF. Well, what happens if, something we don't have, like if, I don't know, like the implant won't fit, or, having a plan B, particularly like, let's say lateral. Let's say you're planning to do a lateral and perk screws with the surgeon. They get in there and femoral nerves in the way. Can't use the lateral implant. Now they got to switch while the patient's asleep to a TLIF. You got to make sure that, you have that set available. If they ain't no TLIF set there, and you're kind of hosed. So I think that's where I've seen reps have the most success, are those that are really knowledgeable about, well, let's plan for worst case scenario. How can I be ready for that? Or maybe your trays are contaminated. You never know. And so you just kind of have to be ready for disaster and how you're going to handle that, and preparation for the case too. I really appreciate, my reps that, I have just a small set now because my trust circle is small, but, that we come in, we talk about the cases a week in advance. We know what we're getting into. We know what drivers we need to remove, the screws from the revision case or whatever. So those are all important things I think that a surgeon looks at. So.
Yeah, it's funny. I've asked a number of surgeons that question, and it kind of comes back to those two things. Knowing where your product works and fits, and having a plan B. I think it's it's simple in concept, but hard in implementation. It takes work and effort for sure.
Yeah.
Well, Dr. Grunch, I appreciate your time. I guess one last question. You're a Georgia Bulldog, so who's your all-time favorite Georgia Bulldog?
Oh man. Well, I mean, Herschel Walker is every Georgia Bulldog's favorite,
Yeah.
but I mean, I think outside of him, I really loved Todd Gurley. He is one of my favorite running backs of all time. So, and he was with the Falcons last year. I was super excited. He came back home. And I don't know what's going to happen this year, but yeah. I've even got I don't have it. It's in my office. I have a autographed football from him that says, "As Dr. Grunch keeps saving lives" from Todd Gurley.